Hello, everyone. Oh, fantastic. 15 people. Oh, hello. Great. It is. I'm so excited about this webinar. There's been a few changes that we will make on this webinar. As probably you realize, I'm not Miguel Fernandez. Miguel is in Japan having fun. No, I'm just kidding. Miguel is working very hard, has been working very hard the past week, working on the IP-based or IP-based on the assessment on invasive species. So he asked me if I can moderate this presentation. My name is Carlos Zambrana Torrelio. I am from Bolivia. I work at EcoHealth Alliance. I'm the Vice President of Conservation and Health here. And I'm very excited about this presentation. We have a great speaker today, but I would like to take a few minutes to discuss about one issue that's bothering me over the past week. And I hope you don't mind, Catherine, but I would like to talk about the fires that's happening in the Amazon basin. And I have a short presentation that I would like to share with you. 1 minute, there you go. So there have been fires, as probably you heard in the news, but it's not just the Amazon. It's been all over the place, all around the world. But recently, there's been like more than 7,000 fires in the Amazon, and more than 10,000 fires have started since Thursday. These are all fires that are due to human activity. That's the main cause. And then the problem is that we have people in charge of these governments that are making bad decisions. So, for example, in Brazil, Bolsonaro and his new policies are encouraging, directly or indirectly, a large amount of deforestation by not enforcing the laws that prohibit deforestation. And in Bolivia, my home country, despite talking about Mother Earth in all his speeches, the government has authorized the controlled burn of forests. But that completely got out of control. And now, since the past few days, that more than 500,000 hectares of the Chiquitano forest, a unique ecosystem in the world, has been burned to ashes. So what can we do? Well, there are a few things that we can do. There's a few examples here of what's happening in the Amazon forest, but there are a few things that we can do. Let's talk about I like to talk about the ones that the main problem in this generation is about critical thinking. Please talk to your children, students, neighbors, friends, family, anyone who would like to listen about critical thinking. We need to teach them to analyze facts and form a proper judgment. We need to help them to separate what are facts from misinformation. And this is extremely skill that is going to be super helpful in the future with all the information that we have or misinformation that we receive through internet. Having critical thinking or developing critical thinking is one of the most important skills that your children will have. Second, please think before you vote. There are a few important elections on the upcoming months or years in Bolivia, in the US, in different parts of the world. Please think, we are in this problem, we are in this mess because we, as a society, made decisions and we put inadequate people in a position of power. You know who I'm talking about, you understand me. So take the time to inform yourself about who is going to be a president, who is candidate. Please ask questions about what kind of future you want for your children. And finally, please vote. I know sometimes we are lazy and then we don't want to go vote, but that's extremely important. Don't let other people vote for you. Don't let other people make decisions for you. The future of our world is in our hands. Please, let's do something. And with that sad note, I would like to change to presentations. And thank you, Catherine. Thank you for letting me vent my frustration on this issue. I'm far away from my home country, and it's very hard for me to listen the news, and this is the only way I find like a way to talk about this. Well, with that, it is my pleasure to introduce Catherine Machalaba. She's a policy advisor and research scientist here at EcoHealth Alliance. EcoHealth Alliance is a scientific nonprofit that works at the nexus of conservation and global health. Catherine's research focuses on integrated solutions to target the drivers and impacts of vector-borne diseases and zoonotic diseases. She works closely with the UN Convention on Biological Diversity and the World Health Organization. Catherine also holds leadership roles in multiple organizations, including the IUCN Species Survival Commission, Future Earth, and the American Public Health Association. Without further delay, it is my pleasure today to introduce Catherine. Please, Catherine, you have the webs for you.
Thank you so much, Carlos, and thank you for the opportunity to join for this webinar. It's really an honor, and Carlos, I couldn't have asked for a better introduction. I think you really set the tone for the challenges that we face in our world today, and really the opportunities that we as individual policymakers and experts can really have an important influence in. So thank you for this very inspiring call to action. I'm really honored to present on biodiversity and health connections, and particularly in terms of the solutions for both people and planet. And I think that these are really encouraging, these solutions, and that we really as a biodiversity community can bring to the forefront. And there's a lot that we can really offer in terms of generating these solutions that are so relevant for the environment, but also for health and economy and really across the sustainable development goals. So I am excited to present on some of these connections, and then also some opportunities as we look towards the post-2020 biodiversity framework and other really relevant global and national and subnational policy opportunities. And I'll just, oh, here we are. So when we think about those really critical connections between health and biodiversity, health and ecosystems, I think there's this broad appreciation of the health benefiting ecosystem services that are published in various frameworks. This year, for example, is from the Millennium Ecosystem Assessment published in the early 2000s. But I think these are so important to keep in mind in really our daily work, because they don't get enough attention and appreciation for really how important they are, both economically, both in terms of how we really can value the very critical ecosystem connections and dynamics and functions, and really what they mean in terms of our individual communities and our country's economies, and what really the risk is of losing these essential ecosystem services. You can see here a few examples, and I encourage everyone to check this document. It's available online, the Millennium Ecosystem Assessment, especially the health component of it. There's a really nice summary for policymakers, but these different constituents of well-being and health, in terms of things like disease regulation, just thinking of key issues in our countries. Here in the US, we've had concerns about Zika virus in the past few years, West Nile virus, plague in many countries, and these are so critically connected to our ecosystems and the way that we interact with our ecosystems. So really breaking it down from a very broad concept such as disease regulation, and thinking, well, what is actually what does that mean for our country and the health of our country? And these certainly may vary in terms of the importance for our individual countries and the work that we're doing in our stakeholders, but keep in mind all of these pieces with security, with cultural and spiritual benefits and recreation, and there are so many different aspects of health benefiting ecosystem services, and I think don't hesitate to really highlight these, because they're so important and underappreciated. And then what we face when we lose these ecosystem services, it's really tangible and really critical, and we're faced with this crisis on Earth now, where we are seeing significant morbidity and mortality, illness, death attributable to unhealthy environments. And this is a report that came out in 2016 from the WHO, the World Health Organization, that looked at the percentage of illness attributable to the environment. And I think this is really important, and I think also the wording here, it really reflects unhealthy environments. So we need to really message that when we talk about these statistics, that it's attributable to environmental drivers and connections to environment and exposures, but really it's a consequence of how we're interacting with the environment and changing it, and really the degradation of the environment. And then we certainly see that in terms of infectious diseases, most are shared with animals. These are some things like that we're really familiar with, like rabies virus, influenzas, but emerging infectious diseases too, such as SARS, Ebola, Marburg, and many, many others. And these really have significant consequences for human health and also for agricultural health, livestock health. So, you know, there's a lot that in our daily lives we're really faced with in terms of environmental connections, and really the risks from degraded ecosystems, changing ecosystems. This is really what's driving this increasing health impact from unhealthy environments. When we think more about these recent disease emergence examples, they're really in the news a lot. And, you know, this is just some of many, but what's really important to recognize here is that it's not just human disease. So white nose syndrome, chytrid, these are very pertinent for conservation. We're seeing, you know, really significant declines of some critically endangered species. And, you know, so this is something that when we're looking at these drivers of disease emergence, which we'll talk about more, we can really think about it in terms of human health impacts, but also the conservation impacts too. And I think in this figure here, what's really important to take away, there's this trajectory of disease emergence and spread. So we often hear about it, you know, if there's an introduction of a disease from another country, we hear about the connection from trade and travel, the spread in cities, kind of the ways that a outbreak will change as more people come into contact and there's opportunities for spread without effective control measures. But really what's critical to remember is that there's this emergence phase in the beginning where there's an initial spillover event from an animal or vector to a human or vice versa. And that's where we can really target prevention. So I think the stage 3 and the stage 2 where we see the spread factors in populations are what typically get a lot of the attention. Certainly in public health with response, that's where a lot of the resources are focused, but there's a whole lot that we can do in terms of preventing that initial spillover event and really getting ahead of these disease outbreaks. And that's really where the environmental expertise is so critically needed. So looking at these shared drivers of biodiversity loss and ill health, they're really multifactorial, but what we see is there are some trends that are really, you know, clearly linked to these disease emergence events. So these are things like land use changes, wildlife trade, you know, really how we're changing our ecosystems and allowing for new exposures between animals and humans. And you know, these vary at country level, so it can really be tangible and broken down into what can we do at our country level in terms of the risk factors, and really targeting in on those and saying, you know, what are the safeguards needed to prevent these spillover events. When we look at something like wildlife trade as a driver of disease emergence, we see that, you know, it kind of makes a lot of sense why we would have the potential for disease spillover. Animals in the trade are often in very crowded, stressful conditions. It's a huge scale of trade of animals moving really all around the world. And there's this potential for pathogen pollutions as species are mixed together for the first time. And also, you know, in terms of when we think of an invasive pathogen, this, you know, there's also in the route of introduction for invasive species in general. So a lot of risks here. We know this is a leading driver of biodiversity loss, but we don't always think about the health impacts. So really an opportunity to bring together these concerns. Then extractive industries, when we think of these factors that are associated with land use change, extractive industries are a major one. So these are things like timber extraction, oil and gas, mining, plantations. They typically associated with really major ecological changes, sometimes in a very focused area, but really, you know, changing the environmental conditions, installing roads, so creating new access points, often with new human settlements coming in and new pressures on the environment, whether for food, whether for water, potential for introduction of invasive species too. And unfortunately, we see that these extractive sites are often in areas that are biodiversity hotspots. So this also creates the opportunity for disease emergence because there's new exposures, and there's not typically the process of pairing health risk assessment with the safeguards that go into preparing for these extractive industry projects. So really a missing piece in terms of not assessing really critical risk. And often communities are on the front lines, workers are on the front lines, but these outbreaks can quickly spread when they do occur to other regions very, very rapidly. So a key interface to keep in mind. Transit corridors too. So we see that there's a lot of planned road building across the world. And unfortunately, a lot of this is in areas that are very high biodiversity and really critical for a lot of endemic species. And as we break up those corridors, we see that, or those ecosystems by building corridors, we see that there's often, challenges with watersheds, breaking up migration corridors, but also just new ways to access biodiversity and resources and extract it. So something to keep in mind too, as in our countries, roads are proposed and often breaking up really critical ecosystems. The encouraging piece of these drivers of disease emergence and biodiversity loss is that a lot of them are, happening in real time and happening in the future. So there's something that we can do about it. So really understanding the health risks attributed to them can help us to, bring in a broader audience and say, look, it's important that we really consider the consequences of this change to our ecosystem and really mitigate those negative impacts and potentially, change course as needed. And when we look at kind of, what are the different pieces that we can change course on? So the last webinar that we heard was on safeguards for biodiversity in the context of multilateral and development banks. So we see that there's a lot that can be done in terms of implementing safeguards or changing, for example, the site of a project if possible, or abandoning a project altogether, or modifying some of the behaviors at the sites to reduce risks. But we see that there are all these kind of factors that go into negative health outcomes. So there's a lot of interacting ones, some which are really easy to control in a development project, some which are, a little bit outside the realm. This is something like climate change, which requires a different level of policy intervention. But there's a lot of different opportunities here to intervene, and I think that's really encouraging. So maybe we can't solve all the problems, or all the challenges in one swoop, but we can really target these different entry points and start to make a difference through our collective work. And the EPACE report, if you haven't seen it, I would really encourage you to read through it, because especially the one on land degradation and restoration, because it doesn't explicitly, say that it's emphasizing health, but it really is closely linked to health in many ways in terms of ecosystem services and threats to them on the horizon. So please keep it in mind. And I think what it really highlights is the need for context-specific approaches. So whether it's working at a national level, whether it's looking at international policy solutions, or whether it's looking at, a specific site that, that we're trying to protect the ecosystem in, or that a new development project is proposed for, we can really start to look at the context there and target some specific risks and solutions. And I think we should be really encouraged that there are several recent global evidence syntheses that bring together environment and health in really meaningful ways, and show a lot of endorsement from some communities that maybe in the past haven't looked at these issues so much. The one on the left here, Connecting Global Priorities, Biodiversity and Human Health, this is really a landmark publication. This is a joint publication from the Convention on Biological Diversity and the World Health Organization. It's very robust, very comprehensive. A lot of colleagues really put their heart into developing this, and it's an excellent guide in terms of finding information and taking some key messages that you can use, for policymakers. I think it's really, really compelling, and it's really set an agenda going forward in the Convention on Biological Diversity and its joint work program with the World Health Organization. So something really, really positive. The World Health Organization has released some reports over the past few years about preventing disease through healthy environments, and really looking at the burden of disease attributable to unhealthy environments, and then some opportunities for really mitigating those threats. And then on the right here, The Lancet, it's a leading medical journal, and they had a publication a few years ago that introduced this concept of planetary health. It's so exciting because it's really bringing in the medical community and getting them on board. And you know, I think we should be encouraged by looking at these syntheses because they show that we really have allies from several communities, especially the public health community, that really is recognizing the value of healthy ecosystems and the need for action on them. And here too, when we talk about planetary health, I really see it as synonymous with One Health and EcoHealth and this integrated approach. So don't worry too much about the terminology. I think that the point is that there's a lot of champions now from different communities, and the terms may resonate differently with them, but they really offer this entry point for multi-sectoral collaboration. So then again here, just looking at kind of what our objective is when we're thinking about the opportunities to address the drivers of disease emergence and biodiversity loss in a you know, synergy way. We see that, you know, for the example of disease emergence, there's this opportunity to intervene up front so that we can prevent these spillover events to humans and domestic animals and the really severe health and economic consequences that can result. I think this is such a pertinent policy argument that we can bring to policymakers and say, you know, look, if we do some work, you know, ahead of time to address kind of the exposures and the degradation to the ecosystems and all the factors that lead to disease spillover or other consequences for ill health, there's all these, you know, savings in terms of human lives, in terms of agriculture, economies. So there's a really tangible argument in terms of the need to do this. And I think this is an area that we've really had a lot of success in the policy community because it's very practical. You know, there's a better way to intervene. So I'll talk a little about the international environmental conventions because I think there's a lot more that we can be doing in these communities, these policy communities. And again, you know, keeping in mind, as Carlos mentioned, that we're all policy makers. We vote, you know, we really can have an influence collectively, and you know, as biodiversity experts, we might not always think of ourselves as really the right person for policy involvement, but I would encourage you to consider, you know, getting involved in politics. And you know, there's not a lot of people who have the environmental expertise working in governments, so they really need people from our community. So, you know, keep it in mind. There's a lot of different ways to engage, but certainly don't shy away from policy engagement because your expertise is really needed. Carlos and I have been working a lot with multilateral environmental agreements, typically at the global scale. These are international commitments that countries agree to, and a few examples are the Convention on Biological Diversity, the Ramsar Convention on Wetlands, and then several specific to different pollutants, and then the Paris Agreement on Climate Change and many others. These are, you know, often very complementary in terms of the communities, but they really set some global priorities that countries can work together on and set commitments on. And then the national implementation, I think, is what's really crucial. So these multilateral environmental agreements are kind of the guiding principles, the general consensus and agreement, but then really the hard work is at the national level to implement them, to set in place reporting structures, to track progress, to develop the laws and enforcement systems, to really bring in the expertise and the context for the strategies to really make a difference. The national implementation is challenging. It's very different across countries and the resources that countries have to really make these international policies implementable at country level, but this is really where the focus and the impact can really happen. And I think what's really exciting in terms of national policy, we see that some really progressive national policies can also serve as an example for international guidance. So sometimes some decisions are made in the international sphere that are weak, you know, and they really can be strengthened. And it really helps to have countries that have successfully implemented strong national policies because they're you know, tangible and they show that it can be done. And then I think what's really important for many of us working in non-governmental organizations and other private sector entities it's that we can really have an important role in national implementation and providing technical support. So I work a lot with the Convention on Biological Diversity and other organizations like the WHO and World Bank. And I think our expertise is really valuable and can help bridge from kind of the global policies to the national implementation and regional implementation and subnational implementation too. So there's a lot of different ways to get involved in these different conventions, and I really encourage you to consider getting involved if you're not already. And I'll show you a few examples where I think there's high impact in terms of a One Health approach. One area is under the Convention on Biological Diversity, the Aichi Biodiversity Targets. Target 14 in particular is on ecosystems and essential services and the safeguarding of them. And health is explicitly mentioned as one of those essential services and something that really needs to be protected. And so there are these guiding questions for setting national targets, and they need the expertise of people in the biodiversity community, all of you, to really say at a country level, what are the major ecosystems, and then what services are so essential that they provide. And then looking at the links with human well-being. And I would tell you, as someone, in the kind of public health sphere, my training is in public health, these links are not always appreciated. So, we can't make the assumption that the public health systems in countries will automatically know that these ecosystems are really critical and will advocate for them. I think we really have to do a lot of the legwork to educate them, to partner with them, to really ensure that these ecosystems are so appreciated for what their critical role is in the communities and in the countries. And then I think looking at the risk factors too, the second bullet about which ecosystems are really at highest threat, how can we track whether ecosystems are improving, and then where do we really need to prioritize our efforts. So this community is the one that can do that and really offer critical success for this target. And with the Aichi Biodiversity Targets, they end in 2020, and there will be a new set of targets and indicators adopted, and hopefully health will be really strong in terms of a focus of these biodiversity targets, because I think it's such a tangible way to say, we really need to safeguard these essential services from ecosystems and biodiversity. So in that vein, we can take this One Health approach, and I think this approach is really exciting because what it's really about is inclusivity. So looking at the links between animals and humans and environment, and we typically show this Venn diagram to show that there is this overlap of all of them, and that you really need this interactive, interdisciplinary approach. These examples here of ecology, engineering, earth sciences, we could have a million others. We could have economics, we have sociology, anthropology, but really thinking about what are kind of the dynamics in terms of humans, animals, and environment, and how can we work together to integrate knowledge from these disciplines to form new solutions. The origin of One Health, the terminology, I think it's really compelling in the conservation community because it started in terms of these great ape die-offs that our colleague Dr. William Parrish saw when he was out in the field working, and these were really causing detrimental impacts to great ape populations in Central Africa. And there was this detection that these outbreaks in non-human primates were occurring right before the outbreaks in humans for Ebola. So we can start to see, okay, there's this sentinel monitoring benefit where we can look at early warning systems and get a sense of when this really critical virus is circulating in populations and potentially can spill over. And this is really a way that we can improve our understanding of interspecies disease transmission, and then look at these high-risk practices such as hunting pressures, consumption of non-human primates, and start to take an integrated approach, because this disease is affecting both wildlife and people. I think here, in terms of the context for One Health solutions, it's really a broad approach. I totally recognize that, and I think that's very good because it provides a lot of opportunities for applying this One Health approach, but it also makes it a little challenging in the implementation. So there's a lot of excitement, a lot of high-level support for One Health, but kind of getting to it in practice has been more challenging. I think it's important to remember that it's not always everyone working together all the time, but really when it makes sense, and to make sure that we're not missing critical information or critical sectors, especially the environment sector, because I think the expertise of the environment sector is often left out in terms of really critical health impacts and critical health information that we need to appreciate. So making sure that each sector, the human, animal, and environmental health systems and sectors are strong enough that they can really have a seat at the table, they have the resources they need, and they really can weigh in for these critical connections. When we look at a specific disease and applying a One Health approach, the context can vary. So for the example of Nipah virus, there's spillover from bats, but there's a few different ways that it can spill over. It's a different context in Bangladesh compared to India and Malaysia, for example. So we really need to say, what is the specific context? What are the risk factors? What are the transmission factors? And then bring the right sectors to the table to find solutions. For guidance on One Health approaches, there is an excellent set of background and specific kind of key approaches that the Convention on Biological Diversity has put together. This is online in the 6 UN languages. I would really encourage you all to take a look at it and share it in your countries and communities, because it's really thorough and really, saying how can One Health approaches consider biodiversity, how can One Health approaches really be beneficial to biodiversity. And this is internationally accepted, so please share it, please use it, bring it to your public health policymakers and public health colleagues, and really show these strong links between health and biodiversity. And a key area where I think that we can really look at One Health solutions on the ground is on emerging infectious diseases. And this is something that I'm highlighting a lot because I work on this here, Carlos and I work on this at EcoHealth Alliance. But I think these general approaches about One Health and targeting risk are really relevant to a lot of different health challenges. So when we look here at this map, it's a relative risk map for zoonotic disease emergence. We see that the yellow colors are higher relative risk, so we can start to say, okay, what's happening in those areas? Why might we expect to see greater risk of disease emergence there? Typically, it's because of really high biodiversity and changing ecosystem uses and pressures on ecosystems, those drivers of disease emergence, and then typically weak public health systems. So kind of a mix of risk and vulnerability. We're seeing these really exciting One Health projects on the ground that are targeting these risk factors, that are looking at these hotspots of disease emergence. One is the Predict2 project, which has been operating over the past 10 years in several continents, and now specifically looking at these drivers related to land conversion, animal production systems, and animal value chains, really targeted to the specific context of each country that it's working in. And it's conducting integrated human and wildlife pathogen surveillance paired with a behavioral risk survey to look at how communities are interacting with wildlife and the reasons and potentially acceptable alternatives that could reduce pressures on ecosystems and reduce risk for human health. And it's really exciting because it's generating biodiversity and health information. For the first time in some of these regions, we're conducting genomic sequencing, both for viruses, but also for detection of biodiversity and seeing what species are there. Some of these species haven't been totally speciated. I think we found a few new species in the project too. So this is a great way about working together and also introducing new ways of sampling animals, because we use humane sampling and it's based on catch and release. So a nice way of bringing together different sectors. In a lot of these countries, we're working closely with the health authorities and also the environment authorities. And in some countries also working with broader One Health platforms that include disaster risk managers and even finance ministries. So we can start to think about, okay, when we are finding diseases, what does this mean for a community? What does this mean for a country? And how can we reduce risks at these different interfaces and disease drivers? I think another area too that we need to keep in mind for One Health is avoiding unintended consequences. So we heard last webinar from our colleague at the ADB about the safeguards. I think also when we're looking at response to disease events, there's sometimes a tendency to say, okay, we need a quick solution. We're going to do something that appeases the public, but there's not always necessarily the consideration of the health impacts more broadly to the environment. So we've seen this with vector-borne disease control and the use of DDT and the really detrimental impacts on eagle populations and other bird populations. We also saw this with avian influenza control. There have been several highly pathogenic avian influenza outbreaks in the past few years, and wild birds are the natural reservoir. We kind of expect to see low pathogenic avian influenza, but sometimes there's this mixing of strains, and especially when they get into domestic birds, there's higher potential for really severe outbreaks that can also be transmitted to humans potentially. And sometimes there's a jerk reaction to, to kill wild birds, or, in some cases, even bleaching of lakes. And these, of course, make the problem worse and have all these unintended consequences, and they're not cost effective. So I think as a conservation community, we really need to be aware of, what are the potential solutions that are inclusive of environment and that are not, actually making the problem worse, and really messaging this to the public health community and working with them in constructive ways and saying, there's all these considerations that we can work together on for One Health approaches that really emphasize environmental health and human health and promote long-term control and prevention. And there are a few different groups that are, working on these One Health approaches and responding when there is this kind of detrimental impact of the environment from disease events. This was a statement from a few different groups. And, we said that killing wild birds is not an appropriate control measure, and really outlining the scientific rationale as to why. But I would really encourage you to be active in your own communities as you're hearing things on the news, and making sure that there are those links with your public health agencies and livestock agencies. So there is this sharing of information and making sure that we're not seeing these negative consequences. I think another really exciting area is the messaging to the population, to the public. Carlos, you mentioned this in terms of awareness, but I think when we're talking about reducing disease risk and the many ways that we can live safely among animals, and we can also think about getting the message out about biodiversity. So this was a really exciting campaign for under the Predict project, where we're bringing a book about living safely with bats, but also saying, here's why bats are so important for the ecosystems in terms of pollination, in terms of insect control. So, you want to avoid having bats in your homes, for example, and maybe, limit your interactions with bats, handling of bats to prevent disease risk, but you also don't want to go out and kill bats in your community. You really want to find that balance. And so it's a nice way to use these public health messaging campaigns to also have a greater good for biodiversity. There's also some really nice examples of One Health in practice and the benefits that can be derived from it. Sentinel monitoring here, I talked a bit about also for Ebola virus, but we're starting to see these really nice case studies that show the benefits for health and environment. And then quickly, I'll just go into some work that we've been doing with the World Bank. And there's a One Health operational framework that came out last year, and it looks at how to strengthen human, animal, and environmental public health systems at their interface, so really the One Health approach. There's very tangible guidance in here. It is targeted, to infectious disease, but I think it's a great starting point for working together. And really, I would highlight in this table the prevention column, because prevention and detection, I think that's where the environment community can really contribute to preventing disease spillover, to helping to detect it in species that may be affected or that may be the reservoirs. So, please have a look at this. It's online. It's publicly available. And please, see where the information that you're already collecting can really serve this opportunity for prevention, detection, and response and recovery to emerging infectious disease and endemic diseases as well. The economic rationale, I think just what's important to recognize here is that these disease events, both emerging, which is what we see in this figure, but also endemic too, they're really costly in terms of health impacts, but also the wider societal consequences, impacts on trade and travel, impacts on schooling, agriculture and food security. So, when we're saying that policy rationale about getting ahead of disease events, there is this economic benefit of moving upstream and preventing these really severe consequences. And then in the economics component too, we don't always think about investments in the different services, so health services, agricultural services, and wildlife health services in particular is a gap that's really important because many countries don't have wildlife health services. So they're not able to look at the risk factors, and if animals are suffering morbidity and mortality events in wildlife, they're not likely to be detected. So this is a really key area. Many of your colleagues and communities are working on the ground and often seeing disease events in real time. And there's not another source of information for this in most of the world. So wildlife rangers, conservationists are really the eyes and ears on the ground. So, recognize the value of that information and really use your political involvement too to make sure that government services are strong enough to include this, because it's really a missing piece. And we need this information to better form these synergies across sectors and ensure that environmental and wildlife considerations are really part of disease management strategies. And really quickly, I'll just give a last example about how we can use this One Health approach to optimize policies. So this is some work that Carlos and our colleagues here at EcoHealth Alliance are doing, and looking at when there's a decision to develop a landscape for whatever reason, and this example is specific to palm oil production in Southeast Asia, but we say, what is gained? So is it economic development? Is it jobs? But then also, what's the trade-off? So what's given up when we do develop a unit of land? And sometimes those trade-offs are really important, but not captured economically. So we need to really think about, what are the trade-offs in terms of land use and land protection, and how can we optimize the societal benefits? This is a great model that our colleagues produce, but really showing that sometimes what's kind of optimized in the private sector is really different than what's optimized in the public sector and the community, the society at large. So there may be a trajectory of land development. It may have already been a negative consequence for society in general. So you have, certain groups that may be benefiting and really to the detriment of other groups. So this is a call to really consider including health impacts in your economic considerations, and think about, what does it mean in terms of ecosystem services? Are you including health benefits, health impacts in your calculations? But it's a potential input that I think is really important and can be quite tangible. And then that can inform decisions under RED and other frameworks. And we really, in terms of RED, it's critically important, but I think there's so much missing from those calculations. So the more that we can show the benefits to health from protecting ecosystems, the benefits against disasters and the resilience benefits across society, I think the more that these ecosystems will really be appreciated. So the opportunities for people and planet, there are many with the One Health approach. So one is the integrated risk and impact assessments and safeguards. So including health in these impact assessments, looking more broadly at social impacts, and really putting an economic value on this. And then policy changes at all levels, considering working with industry, sometimes it's, challenging because we don't always agree with the practices, or we know that they're very detrimental in some industries, but I think we really need to, because there's a lot of voluntary practices that can make a difference, in aggregate. And then changing standard practices, for example, working with industry to say, are you providing your workers in these extractive industry sites with a food source so that they don't have to go out and hunt wildlife, or making, prohibitions against wildlife hunting or keeping wildlife, so they can really have a role in their worker population and the broader community. And then this mainstreaming piece. So when we're thinking about biodiversity and ecosystem mainstreaming, and this is a big focus of the Convention on Biological Diversity, but there's so many benefits of biodiversity to health, to agriculture, to disaster, in terms of finance decisions, tourism. So we really want to mainstream across sectors. So we put a lot of work into the National Biodiversity Strategies and Action Plans. These are so important, but often we don't really think about what is their relevance to these other sectors. So, we really need these mechanisms of sharing the NBSAPs with the human health sector and saying, look, we address water security, water safety, water quality. We address, all of these different factors related to your sector. So, we need their support to implement the National Biodiversity Strategy and Action Plan. I think, assume that the government agencies are typically siloed, and plans that are specific to one sector will not be shared with another. So you really have to do the work to get other sectors at the table and show the relevance. So here's a really nice visual from this CBD WHO report, where they show all of these other sectors where we can have an impact by mainstreaming biodiversity. And then this is a landscape of One Health tools from the World Bank operational framework. And you can see many of these are not specific to the environment sector, but have really important areas where environment can be integrated, wildlife health can be integrated, but typically hasn't been. So I would encourage you to work on any of these processes that you can, because it will really make a difference, and to start those One Health solutions in practice. And then to think about how we can link conservation strategies to health outcomes, there's some really nice work being done in terms of ecosystem protections and the red list of ecosystems. But when we see here something like the risk of endangerment status of an ecosystem, and then the conservation strategies, we see that so many of these, so forest restoration, water protection, so many of these have critical health benefits. So please, message this to the public health community, and really appreciate how impactful that is, not just for environment, but really for people, economies, and health. And here too, in terms of prediction and mitigation of disaster events, keeping in mind that, we're starting to predict events more, and there's a lot that we can do about them. So Carlos, you mentioned the forest fires, really detrimental, and there's so many health consequences that will result. So, making an argument for the opportunities to mitigate upstream and really change the course of these events. And then lastly, just in terms of the communities that we can work with, I think the NatureServe, GeoBond, and EcoHealth Alliance group, by bringing together this webinar platform, is really promoting this community of practice. A parallel one that I hope that we can see wonderful integration with is the Consortium of Universities for Global Health. This is a group that I've been fortunate to be a part of, and they have tremendous focus on planetary health, One Health, environmental health, climate change, and pollution. They're really keen to see sessions on this at their annual meetings, and they really are passionate about changing the course of service delivery for global health, but also for the policies around it. So I think a great group that we can liaise with and collaborate with, and I would encourage you for their upcoming meeting. It's in Washington, D.C. in April 2020. And the abstract submission is due in 2 days. So there's still time. Please get your panel proposals in. But, really show your work at these events and form these alliances. And then lastly, just to look at where we can go forward with the post-2020 biodiversity framework and global goals. There are a lot of existing global goals, so the Sustainable Development Goals, and these really have so many areas of entry point for biodiversity and ecosystems to drive success for these other targets. Some that we might not be so familiar with are the Global Health Security Agenda, and then the Sendai Framework for Disaster Risk Reduction. Our colleague Shadia Wanaus, who may be on the line, has been really active in a lot of these communities and really setting up the Bangkok principles for implementation of health aspects related to disaster risk reduction. And ecosystems are such a critical piece of that. So a lot of different areas where we can really have a positive impact by working together. And then some key resources here to learn more and really engage. I think the CBD decisions are a great area for our community to really advocate for and at a national level, make sure that we can help assist in implementation. But then there are other manuals, operational frameworks that are coming to light. So, make use of those and develop them for your communities and your work as well. And I look forward to collaborating. Thank you so much.
Fantastic. Thank you so much, Catherine. Now we have 10 minutes for questions. Please either type your question on the box or raise your hand if you want to talk. Thank you. So we have a question from Emily Hirata. It says, when it comes to land use change, how do we balance growing needs for human expansion, growing cities, population, etc., like roads and agriculture, while also trying to protect and not disturb natural ecosystems? What are some really practical ways to ethically go about both without disturbing the other?
This is a great question, and Carlos, feel free to add in too, because you're working a lot on this. I think, we have to always take that context-specific approach, because every situation is different, each community is different, the priorities are different, and sometimes, there's an option to relocate a site. So, if you can have mitigation effects by relocating it to a different area, that's an option. Sometimes that's not an option, and you really, need to focus more than on mitigation and adaptation. And but I think what the most important thing is to really appreciate, okay, what are those potential negative consequences, and how do they compare to the potential benefits? And then where are the areas that can be, where we can change the course of it. Sometimes there's, the type of road that you build, the traffic that it can accommodate. If you build a road that's really intended to be a major corridor for traffic and transport, you automatically kind of open it up to a lot of different impacts. So, there's soft building, there's kind of high long-term impact building, and then there's some that can more easily be restored. Carlos, do you have?
Yeah, well, I think you're right. But the other thing is there are always mitigation and methods that we can use. Sometimes we cannot stop development. There are like economic reasons, but also like people want, local people wants to improve their livelihoods. So we need to work with the people, and then we need to, I think, put all the considerations on the table and make a joint decision and how this is going to be affecting road building, for example, could be affecting a community. We have another question from that's from Irma Verhoeven. I hope I pronounced correctly. Does well-being play a role in the research approach?
Yes, excellent question. So I know I talked mainly about health, but absolutely health and well-being, and they're often put together, and different communities too can understand them differently. But well-being certainly is a key area, and with things like cultural services from ecosystems, and how people value ecosystems differently, and EatBase has taken a nice approach of recognizing that different communities, different populations have different ways of measuring the benefits and outcomes of biodiversity. I think well-being is integral, and we have to look at health and well-being together, and certainly mental health benefits of nature are a big emphasis. There's not a lot of research on it, in terms of empirical research and really, high publication records on it. But I think it's something that we need to keep in mind. And if that's something important to a community likely to be impacted by a change in ecosystem use, that's something that really should be highlighted, the well-being aspect.
Perfect. Thank you so much. There's another question from Jessica Felapi. In your talk, you encourage us to get involved in institutions, especially representing national level policies. What could be entry points to get involved in an institution such as the Convention on Biological Diversity? Great question.
Thank you, Jessica. That's a great question. There's a few different ways. So at national level, there's a focal point or several focal points for the CBD, as well as for other UNEP and other UN conventions. So if you go to the CBD website and look at there's country listings, country information, all the focal points are listed there, their contact info. So, consider reaching out to them. Another way is to get involved at the international level too, and, attend the Conference of the Parties or the scientific meetings. They're called SUBSTA. The meetings typically happen twice a year. And you can go and present as an expert. You can, organize side events and panels and share the research that you're doing. But at national level, I would say, getting in touch with the focal points, forming partnerships as they do develop things like the national biodiversity strategies and action plans. And the NBSAFs are a way to implement the convention. So that's the national implementation. It really sets the course for what the country will do over a 4 or 5 year period. It talks about how the country actions will relate to the global indicators, the global targets like the Aichi Biodiversity Targets, but it really puts it into the country context. So take a look at the national biodiversity strategies. Again, they're all online. They're on the CBD website. And then, please do get in touch. That's great. Thanks for your interest.
Yeah. One more thing point about that. It's not just for the CBD, but the same thing applies for other initiatives like the IPBES or the IPCC for climate change or the UN framework for climate change. So every organization have a local focal point that you can contact, and then that person will give you more information on how to get involved.
Yeah, that's a great point. And I would really assume that they probably haven't thought about the links with other sectors so much. So the more that you can make that tangible and relevant to them, the more beneficial it will be.
Right, yeah. So we have a couple more questions. So Nomzi Atama asked about sensitization as a route to addressing the issue of collaboration across disciplines to achieve the One Health approach. What is your take on introducing One Health courses in the curriculum of all different disciplines right from their training, and how feasible do you think that is? What is the best approach to get that gig?
I'm so happy you asked. Thank you. It's a fantastic question. A lot of schools are introducing One Health programs or coursework. There's still a lot to be done. Certainly, I know in the United States, the US public health curriculum criteria have changed, and now they include One Health, but schools are still really challenged with how to actually put that into training programs. So the more research exchanges for students and faculty that promote multi-sectoral collaboration and use approaches that can integrate multiple multiple sources of information. For example, cost-benefit analysis. You can include environmental impacts. You can include health impacts. So as you're doing your research as faculty or students, consider those broader opportunities for One Health. And there are some really nice online, massive online open courses on One Health that schools can use, that students can use. Maybe we can somehow send those out after, or if you send me an email, I can send those around. But there's a few papers recently about One Health in school curriculum and training programs. It's a great question.
And then we have time with one more short question. It's, are indigenous communities knowledge solutions involved as well?
Yes, fantastic question. So absolutely. And in the CBD, there's a really wonderful group of colleagues that are trying to really integrate the traditional knowledge, the solutions from communities. It's very context specific wherever we're working and the different communities and their priorities. And but I think in the CBD, you'll find a really good, strong community working on that. And I can put you in touch with them too, if that's of interest.
Perfect. We don't have more time. There are more questions, but we don't have time right now. Thank you so much, Catherine, for great great job. It was very, very useful. We've been working together so much time on this. But every time you talk, I learn something. So I really appreciate your time and your enthusiasm on this. So thank you, everybody that joined. Stay tuned for the next Pulse of the Earth webinar. We will be in touch soon. Thank you so much. Bye-bye.
Thank you, Catherine.